our next speaker is Anindita Guha Maulik Rungta, who is India's first certified functional medicine health coach from the Functional Medicine Coaching Academy, FMCA. She is also an AFMC Certified practitioner from the School of Applied Functional Medicine. She changes lives by teaching women with chronic conditions how to create long-term health and reverse their symptoms by laying a strong foundation using a unique three-pillar framework based on a functional medicine approach. Her topic for today is prioritize self-care to create an environment for healing. Over to you, ma'am.
Thank you so much. And I'm so glad to be here. I'm just going to get started right away. I'm going to start sharing my screen. Let me know if you can see that.
Yes, I can see your screen and it's on slideshow. Please go ahead.
Okay. So this is what we're going to be covering today. The topic is prioritizing self-care to create an environment for healing. And the reason I chose this topic is because I find that laying a strong foundation is key to not only getting well, but staying well. And even in the functional medicine paradigm that we use, often this gets missed out. So, you know, whether it's, and I'm going to talk about that. So you can go ahead. But I want to share a bit of my story, a bit of my background. It will help you to sort of understand where I'm coming from and why I feel so strongly about this particular topic. So I remember being in the ICU when my daughter was admitted there. She had been put on immunosuppressive medication for her severe eczema. And you know, she was battling for her life. And that is the time when I figured out, while we were going through that crisis, how important was taking care of my own mind, body, you know, important to be there, to be, you know, available for her, right? To take the best decisions for her. And for me at that point, self-care simply looked like, you know, I'm into reading. So for me, the pockets of time that I used to get, I used to read. I used to deeply immerse myself into books. That's, you know, books which were inspiring and uplifting, and that looked like self-care. Now, of course, you may not have to, I mean, I hope you don't have to go through that extreme scenario because that's what led me into functional medicine about 8 years ago and made me a coach that I am today. But even then, self-care might look like, you know, saying no to the second slice of cake. That's self-care, right? Because you know it's not really good for you. Self-care can look like going to bed an hour early simply because you're tired, right? Self-care can look like taking an afternoon nap on a Sunday because it's been a very hectic week. And that's the kind of self-care I'm talking about. Because you can't really be there, you can't really, you know, get well and really sustain that optimal health unless you give yourself that time and unless you're consistent with your self-care practice. So it's not selfish, it's not indulgent, it's not something that is, you know, it has to involve a spa, massage, or, you know, a candle necessarily, and it's certainly not time consuming. It can take as little as a few minutes a day, you know, in breaks. But before we even get to that, I would like to offer you that healing is like a journey. And the reason I use this term very consciously, because when we are dealing with any kind of chronic illness, and I work primarily with autoimmune conditions, you often don't get cured, right? We can't use the term cure because you have to learn how to manage this condition. And of course, you can reverse symptoms, but if you go back to your original habits, you know, you can actually get back to square one. It's about healing. It's about spiritual, emotional, and of course, physical health. But it may not be about cure at all. And it's like a journey. It's like a marathon, right? Rather than a sprint. And it can begin where you are. It can begin exactly where you are right now. You don't need to be anything else. You don't need to do anything else. You can start where you are with these baby steps, with someone guiding you, of course. I mean, that's really helpful. And that's something I missed when I was trying to manage my daughter's health issues. But supporting your body's healing process is your responsibility. And I don't mean that we do not involve doctors. You know, it's a teamwork, it's a team effort, and it certainly was for me, right? Now, of course, I work with other women. I work with their practitioners. It's never either or, it's usually and, right? It's this both and. So both conventional medicine and functional medicine can go hand in hand. It depends on situation to situation. It depends on person to person. But it's your responsibility, you know, to take charge of your own healing. So of course, if you're talking about optimal health And if you're looking at sustaining it, that's the key word here. And that's where my focus lies. It's not about getting your numbers down. It's not about getting a perfect lab report. It's about you feeling that you are at your best. It requires a consistent self-care practice, one which has to be in your daily routine. It involves prioritizing and scheduling self-care activities. You have to do it intentionally. It's not going to happen by itself. And of course, it means making different and healthier choices, right? You have to make better choices, different choices, and healthier choices every single day. Of course, you can get guidance with that. Health coaches are perfectly suited for that. You can get guidance from a nutritionist, from dietitian. So it can be a teamwork, but it means that you need to make better choices every single day. So what did I mean by a strong foundation? A strong foundation involves, it's not an exhaustive list, of course. It involves eating hygiene. I actually start my work with my clients starting with eating hygiene because we talk so much about diet, but most of us don't really know how to eat. It's of course the quality of food that matters, but how we eat, when we eat, that also matters. So just to give you an example, mindful eating practices, sleeping hygiene. It's not about getting your 8 hours in a night. It's about, and I think a lot of other speakers have spoken today, it's also about the time that you go to bed. So all these things have a huge role to play in how you are going to get well and also stay well. And of course, your diet, nourishing activities beyond your diet, and daily routines, of course. And we've talked about movement in one of the earlier speakers talked about movement. This is a key area of focus in my practice because we get access to a whole lot of information. Information is out there, right? Even if you were not working with any doctor, or any practitioner, you would still get information on Google if you wanted to. I'm not recommending that, but the point that is often missed out is what about change? What about transformation, right? Because that's important. If you want to, again, get well and stay well. And that's, again, something that I see often gets missed out. So people do get well, but maybe after 6 months, after a year, they switch back to their old habits and they sort of, go back to what they were earlier, maybe, right? So when I talk about change, when I'm talking about change, I'm talking about to cause to be different, right? We know what change is. Change is something which is constant. We can't really do much about it unless, of course, we want to consciously change something in our lives. So that's something which is constant. And whether it's your diet you want to change, whether it's your movement, exercise routine, whether it's your lifestyle. So we know what change is all about and we know why we want to change. But transformation, that's a different ballgame altogether. Transformation is a significant alteration. And again, there is a way, that is to be sort of, the way that we bring it out in our clients. And that's a huge piece of my work again. And there are various tools that we use, whether it's character strengths, whether it's motivational interviewing, so various tools that we use, positive psychology. But it's about realizing when your behavior is not in alignment with your values and your beliefs. What do I mean by that? I mean the example of a father who's a smoker and who's not able to give up smoking till the day his child gets diagnosed with asthma. That's when, this sort of the transformation really takes place, and he gives up smoking because he knows how it's going to affect his child. So it sort of now comes in alignment with his parenting beliefs, with his value system, right? And it finds it quite easy to give up. So this is just an example that I wanted to share with you. Because all transformation involves change, but all change does not involve transformation, right? And these are the underlying mechanisms for improving lifestyle, right? This is the mechanism through which we have successful functional medicine interventions. That's what we're talking about in this conference, right? But you need to also incorporate aspects of change and transformation to be able to make sure that you can sustain those that kind of health. So people can make changes over time, but the point is to make sure that you're transformed. So when somebody joins, for example, my practice, when they start at the beginning of the program and they're a completely different person at the end of the program, right? They're not who they were when they started out. That's the beauty of making sure that all of this is a part of the program. And I wanted to also share with you the stages of change. This is an important part, plays a very big role of course, also making sure that you are able to add consistent self-care practices. Otherwise, it's hard. It's very easy to begin. It's not only self-care practices, any changes for that matter. And it's then very easy to also sort of slack off or give up, right, midway. But as coaches, this is what we are trained to take, our clients through. And these are the 5 changes, phases that everybody sort of goes through. Remember that it's not a linear path, okay? So it's not about that, we go from phase 1, then phase 2. We can skip a couple of steps, phases, we cycle back to a previous phase. So it's not like one, typical, a very clear progression. And we typically will cycle back multiple phases depending on the situation in our lives. But being aware, really helps as to where we are. So for example, the pre-contemplation place is where we usually start, but this is the place where a person thinks that there is no problem, right? So it's the example of the wife getting the husband to the doctor and saying that, I think he snores and maybe he has this issue, maybe sleep apnea, I don't know. And I think it might affect, I'm worried about him. And the husband says, I don't think I snore and I don't have any. And it can be, of course, it's irrespective of gender. But just an example to show you, it's about the person not being even aware for a need to change. That's pre-contemplation. So he or she will not even do it. Then comes a stage where you have contemplation that I can't do it. I know I have a problem. So I know enough people who are aware that they should be ideally going to bed at a certain point, because, they know it affects their health, but they simply can't do it. They've been contemplating it. They would like to do it someday, but not today. Then, of course, the preparation, right? I may do it. So it's the person who says, I want to change and I will most likely sign up for that fitness program, right? And I probably will do it maybe in the next, after January. January is a good time to start, right? Right now there's Christmas and New Year's. So that's the person who said, I may do it. So he or she is at least thinking about, right? And then comes the action stage wherein you're actually doing, like you've signed up. You've signed up for the fitness program, you've bought your shoes, you've bought your track pants, and you're sort of getting ready. But it's not enough, because just taking action doesn't mean that you're able to sustain it, unless you move into the maintenance where you're actually doing it. You are actually showing up every single day for that fitness program, and you're working out maybe 3 times a week, whatever you've laid out. But again, it's not about going through this perfectly. Nobody does. People do cycle back. That's completely normal. But it's about knowing, especially for us coaches, we know what kind of stage the person is, so we can nudge them gently along as and when required. At the end of the day, you want to reach a stage where you know that there will be setbacks, there will be challenges. So you understand setbacks as opportunities to gather yourself, for breakthroughs, to learn something from them. You also, use these opportunities to know yourself. So this whole journey is also about knowing yourself, increasing your self-awareness. And you can maintain it by having an accountability partner. Maybe you want to continue on this path with these changes. So you can, sign up with an accountability partner. You start journaling so that you put it in writing. There's so many ways that you can actually make sure that you continue on this path. Even when you sort of fall off the bandwagon, you get back on it again. So you can join an online community with a similar interest. Maybe it's a health-related community. You can actually take the help of a coach who's trained to do this. You can, of course, ask for some supportive relationships, foster friendships. So there's so many ways of making sure that you're on this healing journey. And as I mentioned, that I believe that healing is a journey because of this reason. So it's not, it's a journey that takes a while. So you need to be prepared mentally, physically, emotionally for that. And so, of course, setting goals. So once you have sort of got an idea about this is what I want to start with, this is what I want to change, rather than trying to do 20 things at the same time, which typically gets very overwhelming, what really works is setting goals, especially when you're trying to make lifestyle changes, and you can break it down as much as you need to. So usually I recommend that my clients pick up 2 or 3 areas, not like 20 of them at any point in time together, but it's a huge part of lifestyle change. And one of the very, very effective tools that we use and we teach our clients to go through, I teach my clients to go through, is by learning how to set SMART goals. So as you can see, it's specific, measurable, achievable, realistic, and timely, right? So just sharing a few things that really are effective in making sure that you're not slipping back into your old habits, not slipping back to your old behavior, all of that, which has led you to where you are, but, so that you continue along your healing journey. So SMART goals helps you to not only tap into the reason that you want to change, because your reason for wanting to change will be completely different from another person, even though you might be changing exactly the same thing. So I always share this example of a client who I did work with for a while, and she had a lot of arthritis in her knees, a lot of inflammation, a lot of pain. And so we were changing her diet, we were taking off dairy and few other things, and doing some other stuff as far as her lifestyle was concerned. And if I had not worked with her, if I had not, brought out her reasons for changing her value system, her beliefs, I would have assumed that she would have liked to change her lifestyle, her diet, because of the pain that she was suffering, right? Because of what she was suffering with her knee pain, major knee pain. But in fact, what came out was that she wanted to change because she wanted to play with her grandchildren. She wanted to be able to kneel down on the floor, sit with them, play with them, run with them to whatever extent possible. Those were her reasons to change. So because we then, sort of brought that to the forefront, and not because what Anindita thinks the reasons should be, she's been able to, even now when I'm in touch with all my clients, even now after a couple of years, 2-3 years, I know that most of them are able to hold on to many of the changes because they are not the person that they were when they actually started on this journey. So just sharing one example, so it has to have value for you, right? And also sometimes you also need to know why you don't want to change. What is the resistance? Because you might be giving up something. So if, for example, if somebody needs to sort of give up alcohol, we were talking about non-alcoholic fatty liver disease just before this, but for whatever reason, if you have to give up something like alcohol or any other stuff, right, which is, is affecting your health, but it might mean that you might have to change your entire social circle, because you might mean that your friends are actually quite heavy drinkers, and that's quite hard to give up. And that might be the reason why you're resisting change, right? So just a few examples. Okay. So I'm just going to share a few ideas for self-care, because self-care is such a vast topic, but just I wanted to share so that you have some practical ideas and tips of what self-care can possibly look like for you. And there are various aspects to it, categories, and I've categorized into 4 different quadrants. So we have emotional self-care, things like learning to say no, which basically means setting healthy boundaries, especially true for women. We need to learn how to say no to certain requests, certain demands, as depending on the situation. Laughing, crying, which means feeling our emotions, right? So that's something that we often don't give much importance to. Watching a funny movie, taking a moment to allow your feelings, just to be present with yourself, right? How much time do we really take in a day to be present with how we are feeling? And this is especially true because I deal with, women with so severe illnesses. I teach them how to be present with themselves, because it's really hard. If you're suffering, if you're struggling, if you're in pain, it's really hard to be with yourself at that moment, right? So, how can you do that? Practicing forgiveness, and forgiveness means towards yourself first. And of course, it might mean towards somebody else. It might mean towards your own body, because your body might feel like an alien. It might feel completely out of control. So practicing forgiveness and self-compassion is a key part of my program, because that's something I know is really needed. Physical self-care, of course, so whether it's stretching, whether it's exercising, drinking water, this is something that we are more familiar with. Going to bed early, sleep is one of the most underrated self-care activities, I would think, and I think quite a few speakers have spoken about that. Dancing, etc., can mean anything, really, in the physical space. Social self-care, asking for help, right? Because we might need the help, especially if we are dealing with issues, or if we have a loved one who's struggling with health issues. So asking for help is often important with, of course, people who we trust. Who do we spend time with? So spending time when our levels are already low, and I'm talking about emotional energy, physical energy, we need to spend time with people who lift us up, not bring us down, right? So we need to be tuned into our own energy. Joining a support group or a community, that's the beauty of being, having access to social media. You have communities that you can be a part of, support groups. So make sure that you are, using that opportunity, fostering friendships, of course, catching up with friends. So there's so many actually ways that you can do this. spiritual self-care, right? Meditation, mindfulness. Again, it's not about just starting to meditate. It can be just mindfulness is about being present, right? Being present as much as possible. It can using your breath. Again, you don't have to start meditating for 45 minutes in a day, sitting on a cushion. That's not what I'm talking about. I'm talking about if you can do that, nothing like it. But I'm talking about practicing mindfulness, spending time in nature. We again underestimate how calming, how grounding it is. If you have a small patch of grass, even that, even if you step outside for a few minutes in the morning with the sun on your face, that itself is grounding and calming, right? So that's what I'm talking about. Singing and dancing, things we used to do as we were children, we forget that. And there is something that I tell my clients, and we talk about so much about other vitamins, right? We talk about vitamin K, A, D, and we've been talking about, and those are important. But we forget about vitamin J, for example, right? Which is joy. As children, we naturally knew how to have joy in our lives, how to find those moments of joy. We forget that as adults, and that contributes to our stress levels. So vitamin J, be inspired, pray, just find the important thing is to find what works for you and schedule at least one self-care activity per day into your calendar, right? That's another tip that I'm going to give you. Whatever you want to get done, no matter what it is, right? Any kind of activity I'm talking about, you need to schedule it. We are so busy, hectic lives. Unless you're putting it in a calendar, like an appointment with yourself, more often than not, it's not going to happen. So make sure that you're putting it in your calendar. And of course, make a list of books, podcasts, resources, YouTube. You have access to so much, right? That inspire you and motivate you and keep you going, especially when the going gets tough. And begin your day and end your day with rituals. Right? Rituals are calming. Rituals are grounding. They help us balance out our emotions. So I'm talking about morning rituals. Can be as short or as long as you want it to be, as elaborate or as simple. For me, it means having tea with my husband. It means a bit of breathing. It means a bit of energy practice. I practice Qigong for 30 minutes. It can mean whatever it wants to be, right? You have to make it work for you. And ending your day with a similar thing. Right? So having some kind of practice is really key.
Excuse me, ma'am, 8 minutes to go.
Yeah, we're almost done. So this is in summary for that, right? Just about all of that I've talked about. And this is actually, I wanted to share it here. This is a freebie that I'm offering to all the audience of IAFM who are joining us. And I've compiled a list of different resources on autoimmune disease because that's something that I am focusing on. And I find that there's a million resources on Google, but it's very difficult to find books, podcasts, resources that are credible sources. So I'm just offering that. And yeah, I think I'm done. I'm just going to stop sharing.
Thank you so much, Anindita ma'am, for putting your words on self-care. Oftenly, this is very much ignored by each and every individual, and they actually focus on things. The career is important and personal life is important, but they forget about themselves. I have some questions for you. The question is that are there any special tips for on self-care focusing for practitioners, basically, to handle stress, especially healthcare practitioners, to handle the stress and responsibility related to patients as well?
So I think the one thing that is common for healthcare practitioners that I found is a lack of time. You don't have time, right? So telling someone that, you need to take out 45 minutes in a day, 1 hour in a day, it doesn't really work. So I have the power of mini breaks. So scheduling these mini breaks in your day is really helpful. And I would suggest that, especially if you're a busy practitioner, scheduling it in your calendar it's by the hour or every 2 hours, but it's like an alarm which goes off. So you take that 1 or 2 minutes to breathe, yeah, and then just ground yourself. So you're basically activating your parasympathetic response from the sympathetic response. That's one of the most easiest and most effective ways to practice self-care during the day.
A patient is asking, attendee is asking that how is your program planned? Like how many months, or is there something that can be achieved with your program?
It's 6 months, and I can share the details, and I can share the link later. It's a 6-month program. Yeah, it's a 6-month program because it takes time to go through the entire program. It is on 3 pillars, and it's simplify, reconnect, and sustain. There's an intersection which is heal, simply because we need all 3. right? So I simplify the face of healthcare because it becomes quite complicated. Which diet should I follow? Should I do keto? Should I do paleo? All of that. Reconnect means connecting all the dots. What's going on? Why have you reached till here? What you need to focus on first, prioritize, and then sustain it. I think that's another piece which goes missing. How do you sustain that over a period of time? So yeah, it's a 3-pillar framework. So I've shared the link, I think, or I'll share the link.
Yes. Apurva Reddy is asking, what is your take on somatic healing for vagal tone?
I am not familiar with somatic healing per se. I know people who practice that. But again, I would say, Apurva, that find what works for you. Obviously, making sure that you are not predominantly in the sympathetic mode, which is the fight or flight mode. It doesn't, you can use breathing for that. You can use meditation, somatic healing, qigong, whatever works for you. But switching from that to the rest and digest, which is the parasympathetic mode, that's what you need to focus on. So yeah, so you can find what works for you.
That's it, ma'am. Thank you so much for your insightful knowledge on your topic. Thank you.
Thank you
for teaching us self-care when this is the most ignored topic as practitioners we see. Thank you so much. Thank you.